Hey everybody, Dr. Patel here. Sorry about the delay. I hope you all are doing well this Friday afternoon. This is our Facebook Live, and today we're going to be talking about elbow pain. We haven't talked about the elbow in a long time, and I think it's something that bothers a lot of folks, especially those of us that are active and doing things. We could feel pain in the elbow in various different areas that could really be uncomfortable. So I'm going to be talking specifically about tennis elbow and golfer's elbow. What are they? What are the treatments that are appropriate? And what are things that you should avoid when you have these conditions? So if you like this video, please share it, like it, subscribe, all that fun stuff. And if you have any questions, then please feel free to comment. You can DM us or you can email us at info@fxregencenter.com. So without further ado, elbow pain. What is it? What is tennis elbow? What is golfer's elbow? And what are the things that could be going on in these type of circumstances? So first of all, tennis elbow and golfer's elbow are not only things that occur when you're playing tennis or golf, although they're called these because it is very common to feel these symptoms with repetitive activities such as tennis or golf. So what is it that causes this? So first, in order to understand elbow discomfort and elbow pain, we got to understand the anatomy a little bit. So the elbow is where the upper arm bone meets the lower arm bone. And if you look at the anatomy here, this is a picture of a side view of the elbow. And to orient you further, if you could look at my arrow here, I don't know, can you see my arrow? Yeah, there we go. So when you look at my arrow here, this is the upper arm bone, and this is the forearm going over to the hand, and wrist and hand over here. And this is the tip of our elbow, right? That's the tip right here. And this is a side view of your elbow. So if I'm looking over here, this is kind of what we're looking at right here. So the upper arm into the forearm region, okay? Now, this muscle mass over here is a mass of several different muscles that comes and attaches out here on the side of the elbow. It actually comes and attaches on the side of the end of the upper arm bone, and that's called the lateral epicondyle. That region is where all of these muscles that make up the back of our forearm come and attach. And these muscles are in charge of lifting up the wrist, of lifting up the fingers, of rotating the forearm. All these muscles come and attach at this area, at this common tendon called the common extensor tendon. And the way that we can get an injury in this area, which is where tennis elbow takes place, is when we have abnormal motion of extending the wrist or extending the fingers or rotating the wrist, rotating the forearm. So things like if you're playing tennis, let's say you're right-handed, and if you're doing a backhand and you're extending that wrist or whipping that wrist, or if you're right-handed and you're doing a backhand and extending that wrist, that repetitive extension of that wrist causes an abnormal pull onto the side of the elbow where that tendon is coming and attaching. Similarly, golfer's elbow takes place on the other side of the elbow. And the other side of the elbow on the inside, the muscles from this side of the forearm come and attach, and these are the ones that are in charge of flexing your wrist or flexing your fingers or turning your forearm down. All of those muscles come and attach onto the medial epicondyle or the inside portion at the end of your upper arm bone. And similar to tennis elbow being a problem with your backhand and with extension, repetitive extension in an abnormal fashion, golfer's elbow is when you're golfing and if you're whipping your club like so, that repetitive flexion of the wrist can actually cause an abnormal pull of the tendons that attach there. So this repetitive action in an abnormal fashion is what causes an irritation to the tendon that attaches on the side of the elbow, on either the outside with tennis elbow or on the inside with golfer's elbow. And that repetitive motion, we used to think, ends up with what's called a bursitis. So what is a bursitis? When you have, let's say, I'm going to call this the bone, the lateral epicondyle, with this being the upper arm bone, upper arm, and then here's your lower arm bones, and then here's the tendon that comes and attaches here, okay? And the tendon is attached to various different muscles that we have here, okay? Now, when tendon attaches to muscle, there are little fluid-filled sacs that surround the tendon in order to provide some cushioning. Those fluid-filled sacs are called bursa. And the presumption in the past, when you had tenderness or pain at an area of a tendon attachment, and if you could press there and it causes pain, the assumption, the false assumption, was that that's because there's some inflammation that's going on there. There's a bursitis. If we have an injury, that fluid-filled sac can get irritated, and that can cause what's called a bursitis. So the old treatment that used to take place, and still does a lot of times for this type of condition, is a cortisone injection. You would inject cortisone in the area of the bursitis, and that would improve the pain. And that is still a treatment that a lot of people are doing. However, that is something that we should actually avoid. There is no reason at this day and age that we should be doing a cortisone injection on the outside of the elbow, especially not without any image guidance. A lot of times people would say, oh, it hurts right there, I'm just going to poke right there with a needle, without using any image guidance to see where you're going. However, that we recognize is both, number one, only temporary relief and potentially no relief at all. And number two, more importantly, that potentially can be harmful. So number one, why is it only temporary relief or no relief at all? Well, now with the advent of things like musculoskeletal ultrasound, where we can actually visualize the area and see what's going on, we recognize now that this is actually not, and never perhaps has been, a bursitis. In rare circumstances, we can see some inflammation or fluid or a bursitis that's in that area, but oftentimes it's not a bursitis, but it's aggravation to the tendons that are going and attaching onto that area. So it's actually not a lateral epicondylitis or inflammation. It's not a bursitis or inflammation of the fluid-filled sac, but rather it's an irritation to the tendons, or a tendinopathy or tendinosis that's occurring in that area. Why is that important in regards to the cortisone treatments that we typically put there? Well, if you put a cortisone injection into that area, number one, it can cause some pain relief because cortisone is an analgesic. It decreases pain. But that decrease in pain that's associated with cortisone only lasts for a period of time. And if it's not an inflammation process that we're decreasing with the cortisone, and we're not dealing with the underlying issue of the tendon, well, then the pain just comes back. So cortisone injections could provide only temporary relief and sometimes no relief at all. But number two, what's most important is that cortisone, especially if it's injected into tendon, can actually cause tendon damage to get worse. So I have seen patients that had repetitive cortisone injections into a lateral epicondyle or a tennis elbow, and actually went from having a small tennis elbow injury to a major tear. This is something that's really, really important, and also why, if you're going to get a cortisone injection, it's super important to get that with ultrasound guidance so you can see exactly where you're going. With an ultrasound, you can see where the needle's going, and you can make sure that the needle is not penetrating into the tendon. You can make sure that the cortisone's not going into the tendon and potentially causing harm. But more importantly than all of that is, why inject cortisone in the first place? If there's a chance of it causing harm, and at best there's a chance of providing temporary relief, what are the treatments that we should be doing for this area? So in this type of condition, what's actually taking place is that the tendon fibers have become disorganized. Those tendon fibers have been pulling in an abnormal fashion, and those tendon fibers have become disorganized. So you may have heard me say this before, but basically the fibers of a tendon are what attach muscle to bone, and those fibers of the tendon are like the bristles of a paintbrush. So if you look at this image over here, you can see that the fibers of the tendon are kind of all linear, all kind of lined up together. And again, the way that I describe this is that the bristles or the tendon fibers are like the bristles of a paintbrush. So if you can imagine the bristles of a paintbrush, all those bristles are lined up in sync with each other. And that's what the tendon looks like when it attaches muscle to bone, right? And nice healthy tendon, all those fibers are moving in sync. But if we're doing this repetitive motion over and over again, playing tennis or doing other activities, those fibers start to get pulled in different directions. So they start to get disorganized and start to clump together and start to get pulled in different directions. That's called tendinopathy or tendinosis. And if you could imagine those bristles, you could imagine that some of those bristles will be clumped together. So take a paintbrush and dip it into paint and leave it overnight. What do we get? We get these kind of clumps of bristles that are stuck together. And you can imagine that in between these clumps of bristles, there are some gaps that now form in between. And these are actually degenerative tears inside the tendon. And these are small, little, tiny tears. And believe it or not, tendinopathy and even these small, little degenerative interstitial tears do not necessarily equal pain. It's actually very common for us to have this and have no pain associated with it. But if we have this going on and we keep on going into this abnormal motion, or if we suddenly fall or suddenly lift something funky or do something out of the ordinary, then these tendons can get irritated and can cause inflammation. And even in some situations, then these tendons can actually get more substantial tears. And when this happens, these are the type of situations that can cause pain. These are the type of situations that can then cause dysfunction. Even those are the type of situations that then can cause weakness. So the first treatment before a cortisone injection or painkillers or anything along those lines, the first treatment that we should do for a tennis elbow condition is actually exercise. There's some really interesting research that suggests that exercise and some particular types of exercise can gradually strengthen the muscle tendon, the tendon bone connection. And even some exercises can start to reorganize some of those fibers as we get those muscles moving properly, as we start getting the body moving correctly. The tendon can actually start to heal on its own, especially if we catch it early. Because as time goes on and as those fibers are pulling abnormally in those regions, then what happens is that as the tendon fibers are pulling abnormally at the bone, they used to be pulling in a very even fashion, but now they're pulling abnormally, so then the bone actually can start to bulk up in the areas where they're pulling in an abnormal fashion, and then the bone actually gets what are called bone spurs. And these type of bone spurs occur because the tendon is pulling abnormally at the bone, and the bone is then reacting to that pull. Once we start to go in that direction, this is something that's going to gradually, progressively worsen unless we try to nip this in the bud. So we start with exercises like isometric strengthening exercises, not moving the wrist, but actually just providing some resistance, activating the muscles. We start with gentle range of motion to get the muscle moving properly. And eventually we move into what are called eccentric strengthening exercises. So eccentric strengthening exercises are things like when we take a bottle, we use our other hand to bring it into a flexed position as the muscles are firing, and then slowly bring your wrist down. These are called negatives if you're familiar with weightlifting. An example of this is when you're doing biceps curls. This is a positive or concentric strengthening exercise. Or if you have a weight and you slowly go down, that's a negative or an eccentric strengthening. There's some research, although the research is a little bit mixed, there's some research that suggests that these eccentric strengthening exercises can help with helping reorganize these tendon fibers that have this tendinopathy or tendinosis. So gradually getting into these type of exercises ends up being so important in treating this condition. Now here's the deal though, the eccentric strengthening can actually cause pain. So it's also important to recognize that if we're doing the exercises appropriately, yes, it might be painful, and that's a normal thing. But in doing these exercises appropriately, we also have to recognize that some pain does not equal damage. And if we're moving in a correct fashion, again, under the guidance of a physical therapist or a chiropractor or under a physician that's in sports medicine, things along those lines, if you're doing the exercises appropriately, the chances of actually doing damage are actually very low, even if you're feeling pain. This is really important because we want to get the body moving correctly. And that is the way that healing can take place. Now, if there's still issues with the elbow, then that is a circumstance where orthobiologic procedures such as PRP, prolotherapy, and in most drastic cases, cell therapy, can actually be really, really helpful at treating a tennis elbow or a golfer's elbow condition. And in fact, with PRP, this is one of the areas where we actually have some level 1 evidence, randomized controlled trials that show that PRP could be beneficial and with medium to long-term benefit in comparison to the short-term benefit that's gained from cortisone injections. So overall, tennis elbow and golfer's elbow are conditions that involve a repetitive motion, abnormal repetitive motion over time that causes injury or irritation to the tendons that attach on the elbow. These are typically not a bursitis condition or a tendonitis condition, which are implying that it's an inflammation. If there's inflammation involved, it's usually secondary to the tendons not functioning properly. And for that reason, we don't want to do cortisone injections, especially without any image guidance that could potentially cause harm to the tendon. Instead, we want to focus on the exercise to get the tendon and muscles moving appropriately, and if needed, using orthobiologic treatments such as PRP to help that tendon heal. I hope this was helpful for you all. Let's see if there's any messages. Kathy, great. Thanks so much for joining us. If you or anyone has any questions, feel free to comment. I'll be able to answer these after the show, or you can always DM us or email us at info@fxregencenter.com. If there's any other topics that you want me to discuss, whether it's about the elbow or other joints or other areas, please contact us. And if you liked this content, please like, subscribe, share it to your friends, share it to your enemies, and share the knowledge. I hope you all enjoyed the talk today. Wishing you all the best on the rest of your Friday and a great weekend, and I'll see you next time.